I want to share a story about something that happened to me lately. I went to a restaurant to have dinner and I happened to chew several pieces of stones inside my food. I had pain. I went to see a dentist the next day to get checked first. And turns out that I needed to get my fillings done again. So I agreed and we proceeded. Everything took only 10 minutes, which I thought it was rushed. Anyway, it's done and it's finished. So I came back home and I had some pain, but they said it's quite normal to experience pain for 2 weeks, something like that. Pain continued more than a month. From my research, it's not normal to feel the pain more than a month, and I must seek a professional to get it checked again. According to my research, I searched in my own language in Korean and in English as well. Turns out for the proper procedures, a dentist is supposed to use rubber dam. So what rubber dam is, it is piece of the thin layer of rubber in different colors. It can be green, it can be blue, usually those two colors. So they will cover the rubber dam in your mouth, only having the necessary tooth open. So basically, like when you get the operation, they will put the green cloth on it, just only having that area to be operated, right? And then rest is covered by the green cloth, so that doctors can only focus on the area, something like that. So same reason. And another important reason why dentist is supposed to use rubber dam is especially the tooth under the bottom part of the tooth. We have like saliva, so apparently saliva is like fluid contamination. When the adhesive gets glued inside the tooth with the fillings after drilling, just think about logically, like you cannot put stickers on a wet surface. You must wipe and dry the surface to put the stickers so it will stick well and better, right? With the adhesive, with the glue. So the first procedure, the doctor didn't use rubber dam. I don't record that at all. So this time I specifically requested it because I was at that time quite so frustrated, angry, just like a combination of the sad and negative emotions from the pain. And this time it took 1 hour. 1 hour versus 10 minutes compared to the first procedure. And I was praying, please, this feeling I cannot bear. I hope after getting it fixed the second time, I won't experience any pain. So in conclusion, I don't feel the pain anymore, but I definitely feel that the tooth got fixed in a month twice. It doesn't feel the same anymore like last time. Last time as in when my tooth was okay before the incident of biting the stones. It doesn't feel the same. It feels weak. Anyway, second time it was done right. However, another frustrated things that I was told by the dentist is that she suggested that I might have to go through the root canal. But root canal? Hello? In Korean, root canal is called 신경치료. 신경치료, literal translation is nerve treatment. But there's no treatment in it. When we say 치료, treatment, it sounds like you are being treated and then being fixed with something, but it's not. Like basically root canal is getting rid of your nerves completely. And it cannot restore once it's gone, and you won't be able to feel anything. So, of course, I'm not professional. Please don't take my words as it is. If you have issues, please go see a dentist and then get it checked professionally. However, from what I felt from my research was the crown. So after several fillings, when there are no tooth structure to be removed, the next thing is a crown. You will get rid of the nerves, and then you will put the crown. But what would happen is that inside the crown, your original tooth, even if it's there, because nerves cannot deliver all their nutritions and they can maintain the tooth, it will become like a lifeless tooth, basically, like a zombie tooth, right? So most of the cases, when patient opens their crown for a necessary reason at the dentist, oftentimes it became like a dark or black color because it's dead. And eventually you will have to pull it out and do the root canal, right? But hello, I'm super strict with my oral hygiene, and then I've been looking after it for years. All I did at my annual dentist checkup is just scaling, right? Like a deep cleansing for the teeth, and that was all. I floss every day. There was no way that like I was going to do the root canal, totally unnecessary. And I didn't have any cavity. It was from the mistake from the dentist. I also learned that everything is hit and miss, but often dentists suggest the root canal for clients easily, because like patients are suffering from the pain, and after they get it done, like they won't feel the pain, so they suggest it, but that's not always the answer. And of course, even if like someone can look after their oral hygiene strictly, things like that, it's an accident, right? Accident can happen. And I try to stay positive when I had difficult time with the pain, it could happen worse. It could really happen worse than what I'm experiencing. So I'm really thankful that I am experiencing this much of pain, which could have been bigger amount of pain. Also, it was something that's out of my control. That was really unfortunate that there were such objects inside my food. What a possibility to have that. But from now on, I am chewing everything more carefully, because you never know. I cannot trust anymore. So my message is be careful with your food, and regardless of things happening, look after your teeth